As a nurse, I see the effects aging has on our population. Our hospitals are overcrowded, with patients being treated in the hallways and with others waiting for days in the emergency department room for a room. As people age, it becomes more likely that they will be diagnosed with a chronic condition. One common chronic illness is cancer. People diagnosed with cancer must not only cope with the disease itself, but its treatments and any long-lasting effects that can occur as a consequence of either. One long-lasting effect is cardiotoxicity. Cardiotoxicity is the second leading cause of morbidity and mortality among cancer survivors and is defined as the effects of cancer treatment on cardiac structure and function. One symptom of cardiotoxicity is breathlessness. My research aims to examine the interventions that are available to support self-management among patients with cancer-related symptoms. One tool is shared medical appointments. Although SMAs have been shown to improve diabetes management, little is known about its use for other chronic conditions such as cancer. I therefore performed a systematic review to determine the effects of SMAs on patients with a chronic condition, their healthcare providers, and the healthcare system. Compared to usual care, there are no negative effects on patient quality of life, knowledge, and satisfaction. There is no difference on healthcare provider satisfaction, and those who attended SMAs had fewer hospital admissions. My systematic review has further evolved into an application for a CIHR grant to perform a randomized control trial at the Ottawa Hospital Wellness Beyond Cancer program, a program that assists cancer survivors with the transition of their care from their oncologist to their primary care physician. Another tool are symptom practice guides. Although CoSTARS developed 15 symptom practice guides for adults on cancer treatment, none of the guidelines included had a focus on cardiotoxic symptoms. I therefore performed a systematic search to find guidelines on congestive heart failure and uncovered 8 guidelines. The recommendations from these guidelines have been added to the original CoSTARS Breathlessness Practice Guide. The preliminary draft must now be taken to experts in the field to determine its usability by the nurses at the Ottawa Hospital Cancer Centre, to determine its usability by the nurses who provide remote support to adults on cancer treatment. My research is well aligned with the CIHR community-based primary healthcare signature initiative, with a research priority on prevention and management of chronic illnesses at the primary healthcare level. When patients are provided the proper tools, they are able to take a more active role in the participation of their care and are able to self-manage symptoms of their chronic conditions at home.